In this video, we're going to explore considerations for sleeping in second and third trimester of pregnancy. Hi guys, and welcome back to another episode of Working Body Wednesdays. I'm Chris, and I have Dr. Karen Litos.
Hi.
And Corey with us today.
Hello.
And we're going to be exploring the considerations, say it again,
For sleeping positions during the second and third trimester of pregnancy.
I keep screwing it up, guys, so we're going to let her take it from here. So just briefly, before we get into that, tell our viewers what a physical therapist that specializes in women's health does.
Well, I am a board-certified women's clinical specialist, and I am also an obstetrics physical therapist, which means that I work extensively with women who are pregnant, postpartum, and women of all ages who have pelvic floor or abdominal dysfunction, such as incontinence, pelvic pain, abdominal surgeries and pain from that, all kinds of things through the lifespan.
And that sounds incredibly important, an important need, an important niche that isn't being filled. So maybe we'll have to do a whole nother video on that sometime. But for this video, we're going to focus on considerations of posture in the second and sleeping posture in the second and third trimesters. So I'm going to let Karen take it from here, and she's going to use Corey as a model here today.
So while Corey is very comfortable here, I'm going to talk about some of the considerations that happen about 20 weeks gestation and pregnancy through the remainder of the pregnancy with sleeping positions. So as you start to get further in your pregnancy, you gain about 50% of fluid volume, your breasts get larger, obviously your abdomen gets much larger, and that all comes into play with some problems with sleeping. For one thing, you just can't get comfortable. For another thing, in certain positions, such as laying in your back, you are at risk for the baby putting pressure on the main vein that supplies blood back to the heart, which is called the inferior vena cava. So after about 20 weeks, the general recommendation is that you avoid laying on your back for more than 3 to 10 minutes. Most women are not symptomatic, but you still can impede that blood flow. And what can happen is that can affect your health and also the baby's. Now, don't panic if you wake up on your back. Baby gets what it needs first. You likely are going to be the first person to be symptomatic, which means you might feel lightheaded, dizzy, and you'll naturally want to move off of your back. Only 10% of women are symptomatic in pregnancy, but all women should avoid laying flat at rest on their back after 20 weeks, just as a precautionary measure. So laying on the left side, actually, because of the way the baby's positioned, maximally helps the blood flow through the pregnancy. So that's the best way to sleep. But it gets uncomfortable sleeping on your side. So what do? Pillows are your best friend, ladies. So this is an example of a Snuggle-like knockoff. Snuggles are very popular in pregnancy, but they're also very expensive. They cost about $60 to $80 or more. I found this one on Amazon, and it does the same thing as a Snuggle pillow for about $35. So check it out because it can work just as well. There's actually no research that says that a $10 long pillow from Walmart won't work just as well. Or you can use a lot of normal sized pillows and pile them up. The advantage of these long curly pillows are they're less likely to come out of position. As you can see, Corey is perfectly positioned now. She has support under her neck and her head. She has support under her belly. She has support between her knees, so that keeps the pelvis in perfect alignment. And I put another extra pillow down here by her ankles to keep her legs from falling in and keep that pelvis in perfect alignment. Because it wraps around her back, that keeps her from rolling back on her back, and it also allows her to lean a little bit forward if she doesn't want to be straight on her hip, if that's painful, or a little bit back if she wants to be positioned a little bit more that way. Some women, that compression on their hip gets a little bit problematic, so you can alternate in those ways. Women change positions a lot during the night, and that's okay. That's normal. The biggest downfall of the snuggle or anything similar like this is just repositioning it. But it works well for a lot of women through their pregnancy. If you don't have a snuggle, long pillows, regular pillows, they all can work as well. Okay, ladies, for those of you who absolutely hate laying on your left side, remember you can also lay on the right side. It's fine as well. Even though left is best, the right side still provides plenty of blood flow to the baby. And for those of you who just don't want to lay on either side, such as women who might have a pubic symphysis dysfunction, that's the bones in the front of your pelvis, or they just are more comfortable on more upright because they have acid reflux. Remember, the baby is taking up all the real estate, pushing your diaphragm up in your rib cage, and sometimes you just can't breathe. When you're on your back, you have that extra pressure because of the extra fluid and the size of your breasts, so your lungs aren't expanding. So we don't want you on your back, but some women find it most comfortable either semi-reclined in their bed or even sleeping in their recliner. The most important thing is to get some sleep. So if you're sleeping in your recliner, the advice is to avoid laying all the way back flat on it. You want it reclined at least 30 degrees. 30 to 45 degrees is the best recommendation, whether you're laying on your couch, on your semi-reclined, or in your recliner. To show you what that looks like, let me demonstrate. Okay, ladies, so say you want to sleep in your recliner. You know, you have to sleep in your recliner because your acid reflux is killing you, or you're just more comfortable and you need some sleep. You know what? Just make sure it's reclined, or that it's up at least 30 degrees, 30 to 45 degrees. And to give you an idea what that is, this is 30 degrees. So you can see that's a fairly decent incline. Get below that, you might again be compressing that vena cava, whether you know it or not. Now, if you're sleeping in your recliner, some of the other things that might help are making sure that you have enough pillow support. This is just one of those little neck pillows that you can use on an airline just to support your neck a little bit more. Pillow behind your head, pillow under your knees. When you keep your knees bent, that opens up the spinal canal and sometimes a little more comfortable. Are you comfy? Mm-hmm. Good, good. There are different types of pillows, and check it out. There are long ones made of beans. There are shorter ones that just roll up behind your back. You can also find wedges. Those work really well as well. They're made out of foam and they're available on Amazon.
All right, guys, this has been another episode of Working Body Wednesdays with Dr. Karen Litos and Corey. And if you're interested in learning more about what Karen does, where can people find you, Karen?
I have a website at www.nomomleftbehindpt.com. Just remember that if you have problems of pain during pregnancy, postpartum, or at any other time in your life, from pelvic disorders or abdominal pain, you don't have to live with it. There are women's health PTs who can help. Happy sleeping.
Excellent. And if you enjoyed this type of content and you have any questions, feel free to leave a comment below. And Karen's really busy, but if she has time, she may try and answer some here and there. So thanks a lot for stopping in, and look forward to seeing you next Wednesday.
Thank you.